Easter, Britain is on track to be the worst affected country in the region. The UK's death toll has now surpassed 10,000 people, with fears the peak is yet to come. Meanwhile, in New York, the new epicentre of the virus, the death toll remains above 700 people per day, with more than 21,000 deaths across the state. But experts say there are signs of hope, with hospitalisation rates slowly starting to stabilise. For more, I'm joined by disaster health expert Dr. ROBYN in New York and retired emergency nurse John Campbell in London. ROBYN, first to you, this death toll is starting to steady in New York, but there are still a horrifying number of people dying every single day. What is it like on the ground in the hospitals?
Well, what I hear from my colleagues who work in hospitals, they are getting seemingly more of the PPE. About 2 weeks ago, it was very dire, really in very bad shape in almost every hospital. But now they seem to be getting more of it. They are getting fewer patients. But as you mentioned, we are having about 800 deaths a day for the last few days, and they don't see that stopping anytime soon. So now we're having more deaths per day than we typically have in a week in a normal, naturally occurring situation.
That is just horrifying and unimaginable for most of us. John, there are concerns the UK is going to end up with the highest number of COVID-19 deaths of any European country. Are the hospitals equipped for that sort of grim outlook?
I think it very much depends on the shape of the curve and how quickly the cases rise. So if there's a reasonable gradual number in cases, as there is now, then the capacity is there. But if there's a great increase in the number of cases with a corresponding increase in the number of severe and critical cases, then we're going to struggle. But there has been a great deal of extra capacity provided by the NHS, such as in the Nightingale hospitals. So at the moment, we do have capacity. With the current rate of increase, we have capacity. We just have to hope that the rate of increase doesn't become on a steeper curve upwards.
ROBYN, as a disaster health expert, where do you think the US went wrong in preparing for this?
Well, clearly we did not test early and we did not test widely. That was unfortunate because we had some problems with our early test kits. We're still having a problem with testing capacity. Obviously, we need much more testing, and actually we need the antibody testing before we can really relax some of these stringent conditions we're under now.
John, the UK death toll doesn't include people who've died at home, does it? So this toll may be much higher in the UK.
Absolutely. I don't know why they reckon the deaths the way they do in the UK. They're only counting hospital deaths. They're not counting deaths in care facilities, nursing homes and facilities like that. And as well as that, they're not counting deaths at home. Now, we know there's been an increased number of deaths in care facilities and nursing homes. And we know there's an increased number of burials at the moment, indicating there was more deaths last week. And even if you look at the Office for National Statistics, the number of deaths is up compared to the equivalent weeks in the previous 5-year average. So there certainly is an increase in number of deaths, yes.
Yeah, it is horrifying. We thank you very much for explaining it this morning.